Hi, I am Dr. Julie Brown, Carrick trained concussion doctor and board certified chiropractic neurologist. Today, I wanted to revisit what a chiropractic neurologist is and give you an idea of how we think when we're with a patient and taking history, doing all the exams. We literally live in little train tracks, I guess I would call them, and where they're connecting to. But when I see patients, this is a great book that I use when I see them. It's called Vertigo and Imbalance. It's no longer in print. I feel very lucky to have this, and there are some great pictures in there. Such a great picture that I have gone and made a PowerPoint of one of the diagrams that they use. This is one that I discuss with my patients, so they kind of have an idea of what we do. We're not like, I guess we'd be like mini doctors, but we just do it from the viewpoint of a nervous system and how we apply therapy. In this particular case, I'm going to talk a lot about dizziness or vertigo. And to review, vertigo is you get so dizzy that you're holding on to not fall over, and your eyes are usually ticking back and forth, which is called nystagmus. That form of motion is nystagmus. Whereas dizziness, lightheadedness, I could describe as being on a boat. Not your eyes aren't doing this. You don't feel like you really have to grip because you're going to fall over. You could still pass out. It's possible, but it's not the same as vertigo, and they can have two different ways in which they are working. So this is a diagram that is going to give examples of related to dizziness and vertigo, not necessarily to pain or that type of thing. But that nucleus in the brainstem for the vestibular system is really fat. It takes up, there's 4 nucleus on each side. It takes up a lot of room in that brainstem. So when it takes up a bigger space, I tend to think that it's possibly more important. The thing I love about the vestibular system too in this case is that it talks to all parts of the brain, whereas your visual maps of where you are in space is like a nucleus, same as hearing. It is a nucleus on each side of the brainstem. Vestibular system has a bigger impact. And that vestibular system, in this place we're going to talk about the caudal vestibular nucleus. It is related to where you think you are in space. It's very important. If you don't know where you are in space, you definitely don't know where other people are in space. And I might argue these are the people that I see driving on the road sometimes. Makes me a little nervous. But here we have the caudal vestibular nucleus. And you can see there's a lot of areas that go and talk to this caudal vestibular nucleus. And you have a caudal vestibular nucleus, a rostral or one above, and a medial and lateral just on the right. And you also have those same on the left. So when we look at this right here, labyrinth. So you have little labyrinth in the ear. I wish I had mine out. There are these little canals, and then there's also graviceptive organs that perceive gravity based on where these hairs are tilting. And that all comes from the labyrinth. So you have one on the right and one on the left. It's going in there. You're going to get other information from other vestibular nuclei. So the caudal, the rostral, medial, and lateral, they all talk to each other because different parts of this labyrinth talk to different nucleus in the vestibular nuclei, and then they discuss and send the information to other nuclei, in this case, the caudal vestibular nucleus. You have the raphe nucleus, the inferior olive. This you want to keep healthy. It's going to help with timing. I have people clap to a beat a lot of the time with the circular motion, and predicting that timing is very important, but just that motion uses the entire brain. Your facial nucleus, how you make faces, all of this, your motor of your face is related to the facial nucleus, and it fires into this caudal vestibular nucleus. I guess I'm trying to imagine, I'm trying to put that into play. If you're tilting and making a face to try to stand up, it's sending information back to the caudal vestibular nucleus to keep you intact on where you are. You then have this trigeminal nucleus, and that is what perceives pain in the brain, and it also has to do with chewing. Sometimes if I have somebody who's perceiving one eye is kind of seeing higher than the other, I may have them push their jaw and see if that vestibular or the trigeminal nucleus is playing a role in that visual scenario going on. Sometimes it is, sometimes it isn't. The reticular formation is related to you just being awake as a human. It's going to relate to being able to walk, that type of thing. Fires into the caudal vestibular nucleus. The hypoglossi, that is also related. The spinal gray matter, the lateral reticular nucleus. Now, when we go here, this vestigial nucleus and the uvula and the nodulus. Those are main nucleus in the cerebellum, which is the back of your head, and it has direct contact to that nucleus, the caudal vestibular nucleus. And these also have direct contact directly from the labyrinth. It makes kind of this triangle to the brainstem and to the cerebellum. It's the only sensory organ, the vestibular system is the only sensory organ that has direct input to the cerebellum as well. It's not really highlighted in this diagram, but it's there. Tells me it's very important. That cerebellum has more nerves than the rest of your cortex. So again, I would highlight that cerebellum is very important. Anyway, those two nucleus has direct input into there. And then these have kind of indirect input from the dorsal column, which is in the spinal cord, and the nucleus tractus alteris. So both of these come up into this caudal nucleus. As a chiropractic neurologist, I was getting a little off on that. As a chiropractic neurologist, I say, is this vestigial nucleus creating an issue? Is it the other vestibular nuclei? Is it the inferior olive? Is it all three of those or two of those? And I have to, or chiropractic neurologists have to kind of figure out what is going on, what feedback is coming into that vestibular nucleus, because what's not shown in this diagram is this vestibular nucleus then has output to other areas and tells us what we need to do, where we are in space. When I even have this problem. I have one shoulder higher than the other. I'm sure I've had it for a long time. I do this Maddox rod test where I cover one eye, you see a line, and then you see a white light here. They should be on top of each other. Tells me that your eyes are seeing the same thing. None of mine are. I'm sure it happened as a kid from a concussion. None of those are on. So this is why I have this, one shoulder higher than the other. Many people have that, but it's related to it. Anywho, this is how a chiropractic neurologist thinks. It goes based on a nucleus. There's some dysfunction here. What are the things that play into it? Dizziness is more complex than just these things. Don't get me wrong, because we didn't even touch what the cortex does. But from a point of view, this, I think, gives a good example of how we think. If you have any questions, feel free to put them in the box below, and I'll see you next time I can make a video. Thanks.